I actually was raised in Mexico. I was born in Brooklyn, New York, and my parents moved me to Mexico when I was a child, and I lived here till I was 8 years old. And so I had a very strong affinity to Mexico and Latin America to begin with. I went back to the United States in the mid-'60s, and it felt like an alien planet to me. And my family's interracial, and it just was a time when there was a lot of conflict in the United States, and suddenly I wasn't black enough or white enough or Hispanic enough, and so I managed to weave my way through all of those problems and ultimately be a success, but I still felt there was something very much missing, so I wound up back in Mexico. It's a place where I feel that I can have the most impact.
Si está sangrando mucho, necesita. 5, 6, 7, 8, 9, 30.
Well, my name's Haywood Hall, and I'm an emergency medicine physician. I think I've been on a very long odyssey most of my life. I've spent some time after dropping out of high school. I was a musician, and I read meters, and in New York I drove a cab, got a high school equivalency, went through college, medical school, did 2 specialties, internal medicine and emergency medicine, and then I practiced emergency medicine in New Mexico and Texas. And after 5 years of working, I started feeling pretty unsettled and feeling like there was something else that I was supposed to do.
Hay movimientos y hay sonidos bilaterales. Empezamos con frecuencia, ventila ahí. Y dos, y tres.
I was on my way down on vacation in Mexico, and actually I was on my way to San Miguel de Allende, and I ran into a big car accident, and I stopped to help, and there really was a lot of it was a little disaster area is what it was, and there were some very critically hurt people, and finally when the Red Cross came and others, I realized that they really had very little training, and so I was pretty deeply impacted by that. I did manage to, I think, save someone's life, and with some improvised medical equipment and stuff, but that kind of, just burned this idea in my head that, that there's all this knowledge that I learned, and that needed to be in other places where they just didn't have it. Over time, I built up this training program, and it's gotten to be pretty good size. We've trained about 16,000 people.
Hacia abajo, hacia abajo. Y luego hacia arriba. Muy bien. Lo recibes, te lo acomodas como tú estés cómodo.
Well, I mean, emergency medicine as a specialty is a relatively new specialty even in the United States. Most people, I think traditionally, don't even see the emergency medicine as a specialty. They see it as a place where the emergency department is a place where interns go and kind of cut their teeth, and it's not a place where a specialist would make their primary practice, and that's a transformation that's been happening in the world where it's been becoming more professionalized. I still get the question about whether, when am I going to open up my own practice, or when am I going to become a real doctor or something like that,
Si se cansa, si no tiene bastante fuerza, puede usar 3 dedos, pero es lo máximo así. Los dedos con 3 dedos, y vamos a dar compresiones. Estamos buscando como 4 centímetros más o menos.
PACE really was is a effort to develop emergency care in Latin America. That's the way that it started, and there's different areas of emergency medicine. There's trauma and pediatrics and obstetrics, disaster, and so we've basically taken on all of these different areas of emergency care and have tried to develop a community focus for the training. You learn bystander CPR, and you call for help, and then you get an ambulance, and the higher level of care comes and continues the care and adds more advanced interventions, and eventually you get to the hospital and continue to have more advanced interventions until the problem is resolved. And it could be, a lot of it could be resolved before they even get to the hospital if the conditions are correct. And sometimes it's a lot better if you can intervene early in the process so that you can stop bad outcomes from becoming worse. We've had a lot of success in the area of emergency obstetrics.
Uno, dos, tres. Uno, dos, tres.
A lot of Mexico, especially the southern part of Mexico, the vast majority of births are attended to by traditional midwives. So what we've been trying to do is to find a way to provide enough training for them so that they become a real part of the healthcare system when there's an emergency. So there's been a tremendous number of political and cultural barriers to try to train midwives. The traditional midwives, some don't speak Spanish. They obviously don't have a biomedical model for what they do, although they can be quite experienced in a lot of ways. In the last week, we've had a training that we've modified that's basic life support for obstetrics, where we include the first line providers from the health ministry and blend that with midwives so that they can get to know each other and work together a little better. And we think that by training people together, we can eliminate a lot of the barriers that they have between each other and provide better care.
Forma equipos de capacitación, eso se lleva a las comunidades y luego ya conoces quién son los médicos, quién son los otros trabajadores y ya son un equipo.
The other training programs, for the most part, once something's established, then they're reselling the training, but we're always kind of plowing new ground and finding new things, and so I think that we're very much a vanguard organization that way. We try to get the knowledge of emergency care, knowledge and skills out as far into the community as possible.